All right, let's do this. Hello, everyone. My name is R.Latkib. I am a nurse at the CSU. I've been with the company for a very long time, 16 years in total. I was asked to do this presentation. It's a very important one, which pertains to all of us, especially after COVID. We need to be familiar with this information. By now, most of us are very comfortable with this topic. Let me just share the screen here. And this is basically bloodborne pathogens. It's an infection control topic. And I'm going to try to make it as fast as possible. A few things we have to define here without going through the slides, some facts. What are bloodborne pathogens? Basically, microorganisms that are presented in human blood that can lead to a disease. So any microbe that can lead to a disease or an infection. Some of the infections that we are familiar with are Hep B, Hep C, and HIV. The liver is a very important organ to talk about here because it pertains to hepatitis, and hepatitis means inflammation of the liver. Anything with itis at the end means inflammation of. A viral hepatitis means there is a specific virus that is causing your liver to inflame, hence it causes enlargement of the liver, or with a more precise medical term, hepatomegaly, enlargement of the liver. There is a way to for medical professionals to measure the liver to see whether it's large or not. The Hep B virus is another virus that is infecting so many people in America or worldwide. 12 million here in Americans. These are old statistics. There are more new statistics. I haven't gotten the chance to really update the file, but you guys have the idea. It's a silent infection. The symptoms include jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea and vomiting. And this can lead to any chronic liver disease or liver cancer and death if it's not treated. The hepatitis virus can survive for at least 1 week in dried blood, and up to 40,000 people in the US will become newly infected each year, which is very scary. The hepatitis C virus is another infectious disease, and it's most common chronically on bloodborne infections. The symptoms are kind of similar to Hep B. They're a little bit different. Jaundice is similar to Hep B, fatigue, abdominal pain, loss of appetite, intermittent nausea and vomiting. These are symptoms that we find in so many diseases that we experience, and it's very difficult to really know what you have. But you know, your body will tell you if this goes longer than usual. This can lead to also chronic liver disease or death if it's not treated. Lately, they've been talking about a hepatitis C treatment. It's very expensive. Not everyone has the luxury of receiving that treatment. TB is a big one, and we are really concerned about TB at Gracepoint, especially at the CSU when we first get our patients, because we don't know if the patient has TB or not. We, the nurses, once we assess the patients, we do like a TB assessment, and we ask them if they have been exposed, and most importantly, if they've been treated. So let's say the patient tells me that they have TB. I'm not going to panic. I'm going to say, hey, you know, what was last time you had it? Did you get any treatment? The majority of them will tell you they've received treatment, and the treatment lasts 6 months, sometimes more than 6 months. Every case is different. If a patient is active for TB and they haven't received the treatment, the first thing you need to do, of course, not panic, put a mask in yourself and put a mask in your patient, and you need to send the patient to the hospital, report the incident to your nursing supervisor immediately, and find out who was exposed to the patients, because everybody must be treated. TB can be very dangerous, and we have to inform the health department. And of course, don't forget to panic. The signs and symptoms of active TB, productive cough lasting longer than 2 weeks. This is one of the questions we ask the patients during the initial assessment. Coughing up blood, loss of appetite, and weight loss, and night sweats. This is a comparison between latent versus active TB. I'm not going to spend much time here. Let's jump to the HIV virus. Before, it used to be a very scary, dangerous killer virus. Nowadays, there is treatment. I mean, there isn't a cure, but I'm not very sure about the vaccine, but I heard that they're working on a vaccine. If not, the vaccine is out, but it's very costly. And again, it's one of those things that are not a luxury for everybody. The HIV vaccine, the HIV virus is no longer deadly like before because they have medications that can treat the virus and improve the immunity of the patient. Other bloodborne pathogens can be caused by viruses or bacteria. These can circulate in the blood at some phase, capable of being transmitted via different ways. And by now, we should all be experts due to COVID-19 virus. We all went through the pandemic for quite a few years now, and we should be familiar with how viruses can transmit from one person to the other, or from one object to the other, to a person. Some of the examples: syphilitis, hepatitis D, HDV, malaria, which does not exist in the United States anymore. You find this in underdeveloped countries, especially in Africa. They still sometimes have pandemics of malaria, etc., etc. Most of these are not found in the United States because, thank God to vaccinations, our kids are vaccinated at a young age. A biomedical waste is something very important to know. We need to find out where our shops containers are located in each unit. Some things I like to mention to our nurses, because shops containers are different from one hospital to the other. Our shops container have an opening on the top, which is very wide. And I have observed in the past people sticking their hands to dispose of a needle or a syringe. Please don't do that. Just go on top, a couple of inches on top, and just dispose of it through it from the top, because sometimes when the syringes fall, they fall upside down and the needle is sticking up, and you could risk to get poked in your hand. So the biomedical waste is classified as any item that comes into contact with blood fluids. Biomedical waste may be solid or liquid. Examples of biomedical waste include discarded blood, sharps, used bandages, dressings, or medical supplies that may have been in contact with blood and body fluids. The risk of exposure is a very wide risk of exposures. Contamination sources could be the blood. Other potential infection materials could be human body fluids. We don't know what type of fluid it is, or we don't know if it's simply water on top of your counter. If it's not yours, do not touch it. Make sure you wear gloves and dispose of it properly. We have bleach products in the unit. Please make sure you know where they are, and if you dispose of such fluids, do it correctly, so you don't risk yourself getting any of these infections. Any unfixed tissue or organ from a human being, cultures, cultural mediums, or other solutions, experimental animal blood, tissues, or organ infected with HIV or HBV. We receive so many patients and we don't know what the patients have. We are going to treat every single person that comes through our doors as if they are infected, so we can take our precautions. Risk of exposure, again, it could be a direct contact, like someone could have a wound, you have a wound and it's a direct contact, or their blood penetrates yours. An indirect contact, a respiratory transmission. This is a problem with COVID-19, as we experienced before. Someone could be coughing, sneezing. Please, if you cough or you sneeze, do not do this. Do not sneeze on your hand, because that's not the right way to do it. I would either do it this way, or I would do it under my shirt to trap that bacteria or that particular virus, or a vector-borne transmission from tools or instruments. Who is at risk for exposure? Everybody, I'm not going to say only medical professionals or cleaning staff or nurses. Everybody is at risk. The patients are at risk. We are at risk. Sometimes we make our patients very sick. We have an exposure control plan. Please be familiar with that plan. It is on the intranet. Everything is on the intranet right now electronically. We review and update this plan annually. The protective personal equipment is something we're all familiar with right now. The most important one is the gloves. We have gloves throughout our units at Gracepoint. We have masks everywhere right now. Aprons, we have them. The nurses know where they are just in case we have to clean up something messy. Face shields, mouthpieces, safeguard glasses, CPR pocket masks. We have all of this equipment, thank God, at Gracepoint, and it's available to us. If you don't know where it is, please get with the nurses and they'll tell you where it's located. Okay, how do we control the exposure? We have to first observe standard precautions, such as treating all blood as body fluids as if they are contaminated. As I mentioned before, anybody that comes in through those doors, we are going to presume that they are infected. We got to do a proper cleanup and decontamination. How do we do that? Very simple. We use bleach products, or we use any type of chemicals that Gracepoint gives us the okay to use. Please do not bring your own chemicals, because this is something that the company provides. Controlling the exposure, again, we have to regulate the waste disposal. We have to dispose of regulated waste in a closable, leak-proof, red, or biohazard labeled bags only, or containers. And we have those. We have rolls of red bags or biohazard bags. They are located at the nurses' station or the med room. We try to control those as the nurses, because we don't want our staff using them for picking up the garbage from the units or anything rather than that. We want to keep them only for these purposes. We have to dispose of contaminated sharps in sharps containers only. We are not going to throw syringes in regular garbage. We're not going to do that, or anything sharp. Or if we use any clippers or any scissors to clean up a wound and they get contaminated, we are to dispose of them in the sharps container only. Remember the rule of disposing of those sharps on 2 inches above the sharps container to avoid being poked by any sharp material, please. Controlling the exposure, engineering and work practice controls, safer medical devices, sharp disposal containers, hand hygiene. Our syringes right now that we use are retractable. We just have to get familiar. New nurses need to know how to use them. Please do not administer any IM injections until you get familiar with our IM protocols and our IM tools, especially our syringes, because nurses are used to different syringes. There is a button on top of the syringe. Once you press on it, the needle just retracts on the inside. Do not assume the retractable device is working. Pretend as if it's not going to work, because sometimes they do not work. You'll be amazed. And I've seen nurses putting syringes in their pockets when they see the retractable needle. Please don't do that again, because there are faulty equipment and you could risk being poked by that needle in your thigh or in your hands. Please don't do that. Just hold on to your syringes. Walk with your syringe as if you're holding a weapon, straight to the med room, straight to the sharps container, and being aware and paranoid of your surroundings so you don't get jumped on or you don't poke anybody, because I take that very seriously. Again, controlling the exposure, you have to wear protective gloves. I forgot to mention hand washing. I'm not even going to go through that, because by now, after COVID, you should all be experts at hand washing. It is always preferable to use water and soap. We have plenty of those and they're free. We have hand sanitizer. I don't personally like it. I use it only if I am on a rush. Go, 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 go. But I make it a rule, or I take it religiously, to wash my hands at least once per hour in every shift that I work at the CSU. Every hour or every time I get a chance, I wash my hands with warm water and soap, okay? So wear protective gloves, of course, when you clean up anything. Use appropriate disinfectants. Clean and disinfect contaminated equipment and work surfaces. We got into the habit after COVID to clean up our surfaces before we start working, which is a good habit. Truly wash up immediately after exposure. Properly dispose of contaminated PPE, towels, rags, etc. If one of your PPE has blood, please don't dispose of it in a regular garbage. Okay, make sure it goes on a red bag or a biohazard bag. In terms of broken glass, don't be a hero and pick it up with your hands, even though you have gloves. You see the picture here. You need to do it correctly or have the housekeeping do it because they have the equipment. In terms of the laundry, if the laundry is contaminated, it has to be contained in a laundry area. I don't know about the children's units or other units, but I know in the CSU, we know if you work there, we know where the laundry area is. Again, using PPE is one of the ways to control the spread of any infectious diseases and controlling the exposure. I'm not going to go into that in detail. If you don't know how to don gloves, please feel free to go and ask the nurses. They will teach you how to do it. Sometimes you pick up gloves and your hands are already dirty and contaminated, and you put them on and now you're contaminating the gloves and then you're contaminating yourself, because a lot of people are under the impression once they have gloves, they're protected. No, okay? We were taught in nursing school to wash our hands before we actually put gloves on. Okay. It is our responsibility to properly know how to wear PPE. We have to take the training very seriously. We have to care for, clean, and maintain our units and notify when repairs or replacements are needed. And everything is done on the intranet, is sending work orders so things can be cleaned up and fixed. Vaccination is one of the proper and best ways to avoid the diseases we spoke about or the infectious diseases. Gracepoint does offer Hep B vaccination, which is 3 series. There is a first, the second, and the third one, and it's within a few months apart. I suggest any new employee to take advantage of this, and Gracepoint offers this service for free. I believe every healthcare professional needs to have a Hep B vaccine. That's non-negotiable. I think Gracepoint can actually make it a requirement because this is very vital. Again, vaccinations for Hep C and HIV are not available at the moment. Gracepoint does not offer them. Feel free to research if they're available on the outside. I don't have much knowledge about that. If you are exposed to any infectious disease or you think you've been exposed, make sure you wash the area thoroughly with warm water. Specific eye, mouth, or other mucous membranes, non-intact skin, parenteral contact with blood or other potential. Usually when people are exposed, they know that they've been exposed. Sometimes you get spat at by a patient. Don't panic. Wash your eyes thoroughly. In terms of getting HIV, you're not just gonna get HIV because of a spit. The patient has to have a cut in their mouth. They have to have blood. There has to be a certain amount of blood penetrating the wound. You have to have a cut. So don't get crazy and panic. It's not like the old times, assuming the patient had HIV and you got contaminated. We send you to the hospital, and within the first 48 hours, they give you antivirals and everything is okay and kosher. You'll be fine. There are protocols for such things, so it's not a problem like it used to be. If you've been exposed, you must report it immediately to your supervisor. If the supervisor is not there, the next person in command. Make sure you have phone numbers of your supervisors. Please have them on your cell phones. Direct employee to healthcare professionals for treatment. We are going to give you the paperwork and we are going to send you to get the treatment. The most important thing is not to panic. I've seen people panicking in the past, which there is no need for that. Please keep your hands washed at all times, which is the #1 way to prevent the spread of disease. Speaking of that, we do not require masks any longer. But if you think that you're not feeling very well, please wear one. Don't come here and make us sick, okay? Because you get sick, they get sick, and then nobody's going to show up to work. We don't want to do that. And most importantly, our patients will get sick. So just make sure you put a mask on, please. Or tell us, let us know. You have a fever, you're not feeling very well. We are going to take your temperature, and we're going to let your supervisor know whether you should be working or you should be going home. Most likely you will be going home. And don't take it as a hobby to report high temperature so we can send you home. You're not going to fault us because we've been doing this for many years. We know when you are sick. As a side note, when to wash your hands. Whatever the slide talks about here, just get in the habit of doing it periodically. Every time you get a chance, just wash your hands. Use the hand sanitizer as much as possible. Every time you touch something, just use the hand sanitizer. If you use it, please make sure you use it properly. Just rub your hands until your hands are completely dry. I'm not going to go into how to clean your hands. By now, everybody should know how to clean their hands. They tell you wash your hands under the sink and sing happy birthday. The types of PPEs used in healthcare, well, we use gloves, gowns, masks, goggles, face shields, face, mouth, nose, and eyes. Everything you can think of, we have at Gracepoint right now. I hope you guys benefited from this short and humble presentation. If you have any questions, please feel free to contact me directly. I'm Rad. Or shoot me an email at R.Latkib@gracepointwellness.org, or contact one of the nurses in your unit if you have any more questions. Do not forget about washing hands, and don't forget about that Hep B vaccination. Get with your supervisors and see how you can proceed to get one. Thank you very much and have a nice day.